My name is Marty Melville. I would like to discuss with you the effects of trauma on stress related disorders. Townsend et al. Defines trauma as, quote, an extremely distressing experience that causes severe emotional shock and may have long lasting psychological effects, end quote. The effects of trauma on stress related disorders are many and varied, depending upon the traumatic event itself, the individual involved, and the environment in which the event occurred and recovery from the event that takes place. Some of the effects of trauma are evident behaviorally, as in fear impacted behaviors, mentally, as in mental health illness such as depression or anxiety disorders, spiritually, as in hopelessness, and physically, as in increased disease responses. Sun et al. Reported that, quote, post traumatic stress disorder is related to the immune response, including an increase in inflammatory factors and a reduction in anti inflammatory factors. Additionally, it has been demonstrated that traumatic stress disorder and immune disease share a common genetic basis at the gene expression level, end quote. On a biological level, it has been documented that brain activity is impacted, specifically hyperarousal of the sympathetic nervous system, along with decreased hippocampus volume, pituitary, and HPA axis dysfunction, all of which Townsend et al. Identify as neurobiological reactions to heightened stress. These effects have been linked to many psychiatric illnesses as well. Chemical changes seen as dysregulation of norepinephrine, dopamine, and benzodiazepine receptors, either as a result of trauma or as a precursor to trauma, is unclear but substantiated. Trauma stress is identified by Sun et al. As, quote, characterized by obvious changes in the body's physiological function that increases the medical burden in common worldwide informed care, end quote. Thus, trauma-informed care becomes crucial to working with those suffering from traumatic stress disorders. Townsend et al. Emphasizes the importance of trauma-enforced care for healthcare workers as essential to improving the quality of care for clients both in and outside of behavioral health care settings. They continue to describe this approach to care as a, quote, philosophical approach that values awareness and understanding of trauma when assessing, planning, and implementing care, end quote. Principles of trauma-informed care include, number one, a realization of the impact trauma plays and the variety of ways recovery can take place. Number two, a recognition of the signs and symptoms of clients, their families, other caregivers, and society as a whole. Number three, response in fully integrating knowledge about trauma and its effect in policy, procedures, and practices. Number four, an active effort to avoid and resist re-traumatization of those involved. By recognizing that co-occurring mental and physical illness accompany those of trauma-induced stress to include substance abuse and mental illness, one can take appropriate steps to assist with a trauma-focused approach to care. In fact, assisting those who struggle with comorbidity illnesses and addictions without proper knowledge and training can lead to the provision of uninformed care, which leaves the population susceptible to further re-victimization and an increase in their needs for help. This brings into focus the requirements of a mental health practitioner and what can be done to help those suffering from traumatic stress disorders. As a mental health practitioner, I can utilize a trauma-focused approach to help minimize stress for my patients by first becoming educated on trauma and its effect on individuals. This includes training on the trauma-focused approach to care. Next, I can remember to never judge and to show proper respect for the client. Additional steps can be to collaborate and connect, to provide information about the connections between trauma and other health concerns, as suggested by Townsend et al. Continuing to help instill hope in the client and assist with empowering the trauma survivor to guide and direct their recovery plan addresses a future of self sufficiency and options for continued recovery going forward. As one who suffers from stress related disorders on a physical level as a result of trauma, I am fully aware of how devastating trauma can be. Many of my own clients have come to me asking for directions for how to handle their symptoms on an emotional, mental, and physical level. I have been able to guide many of them through holistic methods for reducing anxiety, referring some to practitioners that specialize in trauma and physical results of stress, and support them in their journey through recovery. This is one of the most important aspects of nursing I believe we share as compassionate providers. Thank you.